Hello, my name is Svetlana Bezruchko and I'm health educator. You are welcome on behalf of Paraiso Blood Center to our workshop where we will talk about blood donation campaign. You can save lives today. Let's see some reasons about why we should donate blood. Every 2 seconds, someone in the US needs blood. One donation can potentially save up to 3 lives. Less than 38% of the population is eligible to give blood or platelets. Blood and platelets cannot be manufactured. They can only come from volunteer donors. Donated blood expires in 5 days. Red blood cells must be used within 42 days or less. Platelets must be used within just 5 days. In your lifetime, you will likely need a transfusion of blood. 36 hours is the time that it takes to naturally replace blood lost from the body. Donating blood is good for your heart. Blood shortages happen most during the holidays, so we can see that there are a lot of reasons that why do we need to donate blood? Now, how blood donation helps patients? There is no substitute for blood, and when a patient receives blood, it was given in advance by generous donors. So let's check who needs blood transfusion. Blood transfusion is needed for women with complications of pregnancy, children with severe anemia, people with severe trauma, complex medical procedures, cancer patients, sickle cell patients, patients with chronic diseases, and burn patients. So a lot of people really needs your help and your blood. So give blood and save lives. Now let's read some words of a blood donor. To know that my blood, O negative blood, is literally the doctor's and emergency room's first line of defense, it's very important for me to donate and donate on a regular basis. Let's check what happens to donated blood. Step 1. It's the actual donation. Your donation test tubes and your donor record are labeled with an identical barcode label. Then, your donation is kept on ice before being taken to a Red Cross center or blood center for processing. The test tubes go to the lab. Step 2. At our processing center, information about your donation is scanned into the computer database. Most whole blood donations are spun in centrifuges to separate it into transfusible components, red cells, platelets, and plasma. Plasma may be processed into components such as cryoprecipitate, which helps control the risk of bleeding by helping blood to clot. Red cells and platelets are leukoreduced, which means your white cells are removed in order to reduce the possibility of the recipient having a reaction to the transfusion. Each component is packaged as unit and standardized amount that doctors will use when transfusing a patient. Step 3. Testing. In parallel with Step 2, your test tubes arrive at a testing laboratory. A dozen tests are performed to establish the blood type and test for infectious diseases. Test results are transferred electronically to the processing center within 24 hours. If a test result is positive, your donation will be discarded and you will be notified. Our test results are confidential and are only shared with the donor except as may be required by law. Step 4. Storage. When test results are received, units suitable for transfusion are labeled and stored. Red cells are stored in refrigerators at 6 degrees Celsius for up to 42 days. Platelets are stored at room temperature in agitators for up to 5 days. Plasma and cryo are frozen and stored in freezers for up to 1 year. Step 5. Distribution. Blood is available to be shipped to hospitals 24 hours a day, 7 days a week. Hospitals typically keep some blood units on their shelves, but may call for more at any time, such as in case of large-scale emergencies. Step 6. Transfusion. Physicians determine whether the patient requires a transfusion and, if so, which type. Blood transfusions are given to patients in a wide range of circumstances, including serious injuries such as a car crash, surgeries, childbirth, anemia, blood disorders, cancer treatments, and many others. A patient suffering from an iron deficiency or anemia may receive red blood cells to increase their hemoglobin and iron levels, improving the amount of oxygen in the body. Plasma transfusions are used for patients with liver failure, severe infections, and serious burns. So now that we went through what happened to the blood, let's check the actual blood donation process that we want all of you to live. So the blood donation process from the time you arrive until the time you leave takes about an hour. The donation itself is only about 8 to 10 minutes on average. Registration. We'll sign you in and go over basic eligibility. You'll be asked to show ID, such as your driver license. You'll read some information about donating blood. We'll ask you for your complete address. Health history. You'll answer a few questions about your health history and places you've traveled during a private and confidential interview. You'll tell us about any prescription and/or over-the-counter medications that may be in your system. We'll check your temperature, pulse, blood pressure, and hemoglobin level. Your donation. A whole blood donation takes about 8 to 10 minutes, during which you'll be seated comfortably or lying down. We'll cleanse an area on your arm and insert a brand new sterile needle for the blood draw. This feels like a quick pinch and is over in seconds, and it's actually you won't feel pain. When approximately 450 milligrams of whole blood has been collected, the donation is complete, and a staff person will place a bandage on your arm. And here goes the best part of it: refreshments and recovery. After donating blood, you'll have a snack and something to drink in the refreshment area. You'll leave after 10-15 minutes and continue your normal routine. Enjoy the feeling of accomplishment knowing that you're helping to save lives. Take a selfie or simply share your good deed with friends. It may inspire them to become blood donors. Now, remember that as Christians, we want to follow the Jesus Christ and his sample. So Mosiah 2:17 says, "And behold, I'll tell you these things, that ye may learn wisdom, that ye may learn that when ye are in the service of your fellow beings, ye are only in the service of your God." Please help us and participate in our blood donation campaign. Be a hero. A bit of blood can save a life. Help the cause and give someone a second chance of life. We'll wait for you on December 6, 2020, 10 a.m. to 4 p.m. in 3 Norte, 1105 Viña del Mar. Valparaiso Blood Center thanks you.